Okay.
Welcome back. Thank you for joining me. This is Dr. Craig Weiner with the EFT Hub in a series of the science and research behind EFT. In today's session, we're going to go ahead and discuss freedom from stress and anxiety using EFT. I think that that is kind of an obvious one for most people that have had anything to do with EFT. But we're going to go ahead and explore some of the research papers that are out there, again with the hope that somehow not only do they reinforce what you're doing, they give you more knowledge to what's out there in the field, the ability to share them with other professionals, with potential clients. When you're going to make presentations, you can forward these. Attached with this, there'll be a link to the abstracts and the citations so that you can find these articles. You can also find many of them, in fact most of them, at EFTuniverse.com, and you look under the research tab and you can look under pain and phobia and anxiety, and so many of these categories I've used because they work so well. Dawson Church has done a great job there, so my acknowledgement to Dawson. You can also look to David Feinstein's site at innersource.com. You can certainly go to the AMET website. You can go to the Association ACEP page as well. And so all of these sites are contributing to being able to provide the research for you to be able to obtain. So we're going to go through a few of the most interesting studies that have to do with stress and anxiety. And what we're going to see with that is that EFT can do several things. EFT can be delivered to the individual effectively. It could also be delivered to the group. Okay, as in borrowing benefits. As in a group seminar, you've mostly probably in some way seen that it can be delivered in multiple ways. We can see that EFT can be self-applied. It can be applied by an EFT coach. We see that it can be effective with any number of anxieties that we're going to go over. We're going to be talking about some of the most common ones like public speaking, fear and anxiety with public speaking, fear and anxiety of going to the dentist. What about with the trauma, like a car accident? What about test taking? So we're going to be going through studies that demonstrate the effectiveness of EFT in all of these arenas. So let's begin. We're going to start with public speaking anxiety. Okay, so this was a study that was done several years ago with about 36 people, and here's what they did. They found these numbers of people that had public speaking anxiety, PSA, right? And so with that, what they did was they applied EFT for 45 minutes, and they measured their level of anxiety before, 15 minutes into the session, 30 minutes into the session, 45 minutes into the session, and then immediately they went to a 4-minute public presentation to a small group. So they put them right to the test, put their feet in hot water, and then they went ahead and they rechecked on SUDS and different anxiety scale levels how they did. They also watched behaviors. Now, statistically significant for positive effective findings were all of the measurements that showed subjective decreases, in other words, how people experience decreases in their level of anxiety and stress and fear with regard to the public speaking. The only thing that they didn't find significant was what they called the behavioral observations. In other words, how the hand movements and different ways that they acted that reinforced what appeared to an observer as a lowering of stress levels. But the perceived perception by the people that had the anxiety public speaking all significantly reduced. And that's important. Public speaking is a huge fear for so many people. In fact, some have said that even higher than death, more people have a fear of public speaking than they do of dying. Up to 85% of Americans have a fear of public speaking. So this is a really important one. Actually, I changed that. 20 to 30% of people have a fear of public speaking. Excuse me. And 85% of the public think that public speaking is their greatest fear. So when we look at that, we start to say, okay, if I can use EFT to help talk in front of a video camera, if I can use EFT to speak in front of a small group and be able to go to the hospital or the Chamber of Commerce and be able to tap on myself and work on clients that have a fear of public speaking, there's a large audience that we can help. So that's number one. Number two, people that are scared of going to the dentist. Up to 30% of people that go to a dentist have dental anxiety, and that doesn't even count the people that aren't going. So again, a very significant number of people that dental anxiety affects. I love this study. I haven't been able to speak with Dr. Temple yet, but we're corresponding via email. And what he found in this study is this was a small study that he asked for a period of time all of his patients, how high is your anxiety with regard to the anesthesia, the needle, the drilling, and if they had a score of at least 6 or higher, he invited them to be a part of this study. Now, what I find most intriguing was that what he did was he provided a 10-minute EFT intervention. 4 minutes for explaining what and why he was doing, and 6 minutes of actually doing it. I think this opens up a fabulous opportunity for people seeing that EFT can be used in short doses and still be effective in achieving a great result. So while this study was small, it was a small number of people, he didn't have a control group, he didn't do much follow-up clinically afterwards, and there were limitations to the study, he did find that the average SUD score was an 8 out of 10 before the intervention and dropped down to a 3 after the quick 10-minute intervention. So the possibility for dentists or a dental staff person being able to use EFT to significantly reduce the anxiety related to going to a dentist, which results in less pain and possibly less avoidance of the dentist, is a very powerful thing to know that we've had at least a single study out there. The next study I wanted to go over was done in Turkey, and this was for test anxiety. Now, I don't know how many of you have that, but I certainly get it a little bit, maybe a little nervous, and certainly some people get it to a significant disabling anxiety where they avoid certain courses because they're going to have tests, and it becomes a real problem of lowering scores because of those stress and cortisol levels that result before an exam. So in Turkey, they take these examinations from high school into university, for example, for entrance exams. And so at this private academy, these two researchers, what they did was they took one group of people that they taught EFT to, and then another group, that they taught what they call progressive muscular relaxation, so PMR. So a way that they were able to tighten their muscles, relax their muscles to get a relaxation response. And so they spent 2 hours. 2 hours either teaching them the PMR, 2 hours teaching them the EFT, then they sent them home. They sent them home and taught them to be able to work on themselves over the next 2 months. The results from this study showed a statistically significant decrease in the levels of test anxiety in both groups, although it was significantly greater in EFT than the other. They also showed improved test scores. So, one study there that shows the application of EFT being instructed and then being self-applied to still achieve a significant result with regard to the stress and anxiety around tests for students. Think about the possibilities that can happen in schools when we start to teach children how to be able to apply EFT and be able to use it through the school system that helps them be able to get higher grades, that enables them to get into universities, especially for people that are really troubled by that kind of anxiety. Very important study. Now, this is one that as a chiropractor I deal with a lot. This was a great small study of a physician that wrote up 3 case studies about stress and anxiety related to car accident victims. It was very interesting. Certainly, all the time I am seeing patients, and with regard to the stress of the injury, with regard to the stress of what they saw or didn't see, the fear of returning back to driving again in a particular area or in the car alone, so many different aspects of stress and anxiety with related to car accidents. So he wrote up 3 case studies. One of them was literally he was behind a person that was in a car accident, hit from the side. He came up before the police and ambulance even got there. She was quite shaken up. He said, "Look, I'm a physician, I deal with trauma. Can we try something here?" And right on the spot. First day at EFT, he was able to significantly decrease her stress and anxiety levels right on the scene. Okay? Maybe we haven't thought about, wow, maybe paramedics should be trained in EFT because what they're doing can be very, very helpful in reducing blood pressure, reducing stress and anxiety that can further exacerbate bleeding and stress response at the scene of an accident. The second case study that he did was somebody that had recently been in a car accident, and the stress response resulted for her in urticaria or rash or hives everywhere. And it was interfering with her ability to do her normal activities. She started taking medications for the rash. That made her drowsy. She couldn't take her test. She was getting very frustrated. He was teaching a stress reduction class at a local university. He worked with her for a short period of time, a single session. Each of these were single sessions. And she was able to get off the medication. The hives went away right away, and she moved on and did fabulously well. The last case that he wrote up was a person that had been in a car accident 11 months ago and still was extremely scared to drive, get back in the car. She had whiplash symptoms. He worked with her. It was actually a friend that he had known, and he worked with her in a single session. And what emerged as she was there, her fear of getting back into a car and driving in that area was like a 10 out of 10. When he tapped that down, he found out that she had been in a previous car accident in which her partner had almost died, let alone she had fractures and a pneumothorax and a horrible accident. So of course the second accident just brought back all the fear and stress response and anxiety related to being in the car in both the recent and the further back car accident. He was able to work with her, tap down on all those different fears and all those different aspects related to the current accident, the past accident, and a single session. Did fabulously well, wrote him back later, said, "I'm doing great," with such gratitude. So here were 3 different applications of EFT with relationship to car accidents written up in this study. That was a very nice paper. I like it very much, and I've actually contacted him to be able to get some of insight from him, because right now I'm dealing with a car accident patient that I'm going to look at possibly writing up the effectiveness of EFT on insomnia and anxiety with related to this patient. So hopefully this will also stimulate some of you to be able to think about, God, what it would be like to actually write up a paper or case study on one of the cases that you've had and been very successful with. The last series that I'm going to go over are groups. So in other words, it's EFT delivered in the course of a group or in the course of a conference or workshop, and it began with, let's see, the effects of EFT on long-term psychological symptoms, including stress, anxiety, pain, and other symptoms. And the first one was done, wow, what was it back? 2005 by Rowe. And so this was done in conjunction when Gary Craig was teaching EFT workshops, and he's a psychologist, Rowe, and what he did was he measured, he did these very long intake forms with regard to psychological symptoms, including stress and anxiety and other symptoms as well. And he measured before the workshop, at the workshop, during the workshop, right after the workshop, a month after the workshop, 6 months after the workshop, and noted a significant decrease in so many of these symptoms for a great many people that were in this study that were in Gary's workshop. I think that a piece that they were really looking at when you read Patricia Carrington's review of the study was the effectiveness of borrowing benefits, because certainly not everybody in the workshop got to do a lot of work back then on themselves, so most of the work they were doing was with somebody up on stage with Gary, hence the borrowing benefits. Now, this study was then replicated or followed up on a few years later, and what they wanted to do was see, well, can the same effect be gotten by somebody other than Gary? So what they did was they did it at 4 different places, 4 different workshop leaders. They still used these assessment forms that measured for a variety of psychological and anxiety and stress-related symptoms, and again, they replicated statistically significantly a decrease in those anxiety-type symptoms at and after the event. So now it wasn't just the charisma of Gary, it was actually being delivered in different places by different people and still shown to be effective. Dawson Church then did another replication study, again with hundreds of people in a group, again showing that in a group setting you can still apply EFT and get statistically significant results in decreasing stress, anxiety, and other similar symptoms. Now, in these group studies done at EFT conferences, of course there's also different factors that are going into it. There's a motivation. People are obviously paying to be at an EFT workshop and want to get better. They have a strong intention and strong desire to get better. So we're not saying that any one of these studies is perfect, right? If you read any good research journal, they're going to have, this is what we found useful, these are ways that we would improve it, these are ways that maybe we could have done that better, and this is what we do the next time to show even more effectiveness and make even a better study. So while all these studies have pluses and minuses, they again continue to show the effectiveness of EFT applied in a myriad of circumstances to individuals, to groups, at dental offices, and all the different things that we were talking about in the studies I've gone over. So, again, I hope that you enjoyed this particular segment on freedom from stress and anxiety using EFT. This is Dr. Craig Weiner. Thank you so much for joining us today. Okay, that's it.